You're welcome to PTSD once again. Now it is about diagnosis alone. Without further ado, let's go. I have a full presentation on PTSD and I tagged that PTSD A to Z. If you have the time to listen to that, you can click on this already. Here I'm going to find the diagnosis like it is here right now. You find signs and symptoms, triggers, risk factors, treatment, who should be treated, how can we avoid PTSD complications. Everything that you need to know is right here if you have the time. Please click. Thank you. Now, we cannot make the diagnosis fully without signs and symptoms and thorough history, including physical examination. Let's review the signs and symptoms of PTSD. There's a separate presentation on that, or you click on that very link already provided. Then the features in children. Please click on the link provided and we'll get that fully. Adults will have 4 symptoms in group, meaning a cluster. Intrusion, avoidance, arousal, and autoimmune symptoms. So if you watch my channel and you listen to signs and symptoms as per PTSD, you get all this. Or if you go through the link provided as per PTSD A to Z, you get all these files. Setting occupations and list of risk factors already published. The link is right here. Okay, let me bring it down. So the link is there. Who needs screening? First time presentation of certain conditions will lead to screening. So first time presentation of fear, anxiety, insomnia, bedwetting in a child who has outgrown that, or a child who starts speaking in a particular place, like not speaking at home, but could speak at school, could play with his or friends at daycare, we should start screening for PTSD. An individual with nightmares, particularly adults with nightmares, we should start screening for PTSD. Still on who needs screening. When we are faced with certain known conditions, we will screen for PTSD at the same time. Like anyone with social isolation, living by him or herself, not relating with anyone around, screen for PTSD. Someone had been taking alcohol before, maybe a bottle, in 2 days, a bottle in a week, and suddenly it has jumped up, significantly or geometrically, start screening for PTSD. Somebody is already using drug before or not using it at all, but now start using drugs or using it more than before, then we will screen for PTSD. And some other individuals are working, in a particular establishment, and suddenly they are taking more overtime or staying at work, or they even tell the boss, don't care about paying me for overtime, I enjoy staying here and working the late hours. Why that? They are trying to avoid something at home. So they are whiling away the time. We should screen for PTSD. Also, everyone exposed to a traumatic condition or conditions now presenting with likely cause symptoms after 1 to 3 months. The individual must have gone past acute stress disorder, but intrusion, avoidance, arousal, and mood changes are now presenting. We must screen for PTSD. The tools for PTSD screening will be the following, but not limited to these, and that will be primary care PTSD scale. You can look for that anywhere you are practicing. Then PTSD checklist 5, and then clinician administer PTSD scale. Now, to make a definitive diagnosis, we need DSM-5, and that is Diagnostic and Statistical Manual for Mental Health, 5th edition, specifically written as Diagnostic and Statistical Manual of Mental Disorders, 5th edition will be the one to use. And in that case, it is going to cover a lot of things like the real traumatic event that is so life-threatening or with serious injury, could be sexual attack or anything related to that. Then is this individual directly involved or witnessing it or investigating it or learned about it or is affecting loved one and everything like that? Then they'll begin to look for the symptoms that will form the cluster when it comes to PTSD: intrusion, avoidance, arousal, mood changes. Is it affecting the lifestyle of the person entirely, occupation, interpersonal relationship, and everything will be dealt with. So many things is in this DSM. So the best thing to do is just to go for the DSM and then look out for the facts under that. I bet all these symptoms must be greater than 1 month. Okay, when it is greater than 1 month, then you are likely dealing with PTSD. Do you know why that? First day to 30 days after the exposure to the unpleasant event is still under acute stress disorder. And the individual that will be diagnosed definitively with PTSD under DSM-5 must be greater than 6 years. Now, to make a definitive diagnosis, we must be careful. There must be no street drug use here. And we must rule out any possible medications that could be involved, either a single means or many. We must make sure that we have ruled out all other medical illnesses, and there's no other psychiatric condition or conditions that could be the diagnosis. Still on making the definitive diagnosis of PTSD, let's check what is happening in this individual. Any positive history of trauma? Is this person directly involved? He or she may not be directly involved. It could be as a result of occupation. EMS, police officers, forensic experts, medical examiners, court clerks, even lawyers arguing the cases and going through a lot of exhibits and crime scene investigators, and the list goes on like that, could have just witnessed it. Yeah, someone saw a woman, in the pool at the backyard, just a staff who came around to walk in the house and saw that and felt that this woman is no longer breathing and calls police. He or she may not get, and the man may not get out of that again for the rest of his life. Or even if it's a female, the same way. Or this is happening to a close person around. It's not happening to you, but it's happening to someone pretty close. That could tilt you to PTSD today. Or you are not really involved, but you have full knowledge of what happened. Like when I was going through the list of occupation that will lead to this, because most of the times when we talk about PTSD, so many people limit themselves to the military personnel only. No, there are a lot of people involved in even lab technicians in the hospitals who have to take samples or radiological technicians who will do the x-ray of somebody that has passed through trauma and so on and so forth. You can tell what will trigger PTSD in anyone. Remember idiosyncrasy, right? Go through the list of risk factors already published by me. Close call events, like it has not happened but almost happening, like near accident or near death, and the memory is flashing back in the brain, or there was a serious damage, or the individual could have died, uh, or could constitute conditions that could lead to PTSD. Yeah, the timing. When we want to make definitive diagnosis of PTSD, the symptoms could be present, the history of the trauma could be there, the patient is right here, but the timing will tell us whether it is acute stress disorder or PTSD. Acute stress disorder is all the symptoms occurring the day of the exposure to the traumatic event up to 30 days. That is acute stress disorder. So many people will get out of this. Many people will experience this, but they will not come down with PTSD. However, many of our loved ones, sometimes ourselves, will be having those symptoms persistently beyond the first month, and that is PTSD. So PTSD is diagnosed when those signs and symptoms are persistent more than 1 month, and some will put it as for 1 to 3 months, okay? But there is an entity known as delayed PTSD. Here, the onset is not within the time frame stipulated earlier. It's not within 1 to 3 months post-trauma. It's going to occur in greater than 6 months post-trauma. That is delayed PTSD. Most people would develop signs and symptoms in a few months after the trauma. 25% or a quarter will have the delayed onset of symptoms that is greater than 6 months. Then there's another entity known as complex PTSD. Here, it is associated with repeated events and will have dissociation. The perception of self will be negative, and there is negative self-image. This is not good. Nothing is good here anyways, but people with this may be tilted to more depression and possible suicide. Still on definitive diagnosis, we've taken the history, we've picked the symptoms, the time has been fully defined. Now it's now PTSD, query, but something significant must be part of the history. There must be disturbance in lifestyle, one way or the other, either in activities of daily living or instrumental activities of daily living. So the individual is being affected as per occupation, marriage, interpersonal relationship, not willing to go out anymore, not willing to do many things anymore, sleep pattern is being altered, and the list goes on. So intrusion symptoms are already here. I will not waste your time going back, the flashback and everything. Check my channel for that. I have full info already published on there. Avoidance and mood changes. Please kindly click on signs and symptoms of PTSD right here, or that long presentation through the link already provided. You'll get full info about that. Arousal or hypervigilance. Please check the same link. You're going to find full info. Is it with dissociative symptoms? Please remember to click on the link provided for PTSD A to Z. Is it associated with delayed expression? The link to PTSD A to Z will also help. Now, lastly, PTSD is likely going to be associated with borderline personality disorder and antisocial personality disorder. With that, I've come to the end of this presentation as per the diagnosis of PTSD. Thanks for listening. Please continue to listen to presentations on my channel, and you're free to leave a comment. I appreciate it.